I'm Dr. Manjari Kulkarani. I'm Medical Director at Cloudnine Shivajinagar branch, Pune. I'm working here since last 2 years. The commonest symptoms of first week of pregnancy are nausea, vomiting, breast tenderness, repeated urination, and laziness or sleepiness. Now, as commonest one among them is obviously nausea, vomiting. Almost say 80% of the patients will get nausea, vomiting during pregnancy. 10% do not have any nausea, so they are worried whether they are pregnant or not. And 10% have very severe nausea, vomiting, which will require medication or even IV and saline. Easiest way to manage nausea, vomiting is have small frequent feeds. If you keep your stomach empty for a long time, that aggravates the nausea. So keep on munching something like a small baby every 2 hours. Simple carbohydrates are the ones which are best tolerated. So fruits are the ones which are usually best tolerated. You will like to have some bland food like say idli, dosa, sandwiches, curd rice. Avoid oily things, usually they give a lot of nausea. In case if it is severe, simple medications are given which are usually antihistaminics which take and antiemetics which take control of this nausea, vomiting. Those who have very severe nausea, vomiting where they have weight loss, we admit them and give even intravenous glucose or saline. Second symptom is the breast tenderness, which is not very severe, but it's the common symptom the patient complains of. And as the uterus starts growing, it presses on the urinary bladder. So urinary frequency is another symptoms which many patients complain of during early pregnancy. And because of the hormonal changes, there are mood swings. So there is lot of sleepiness or laziness. Doesn't need any medication. You just have to understand the physiology and behave accordingly sensibly. Okay, the second symptom is the breast tenderness. It's because of the increased level of the hormones. Obviously, the breasts are also growing. That doesn't require any treatment, which automatically reduces after 3 months of pregnancy. Wearing loose clothes, it's only possible management which can be done. The third symptom is because as the uterus is growing, it presses on the urinary bladder. So many girls complain that they have urinary frequency. That also is relieved after 3 months of pregnancy because the uterus will grow so much that the bladder pressure is reduced. But again in the last month of pregnancy, when the baby's head is sitting there, the same symptom will arise. The last, because of the hormonal changes, the women are emotionally liable. And secondly, they feel lot of laziness or sleepiness. So sometimes it is difficult to work in the office for 8 hours, especially in the afternoons. But there is no treatment for this. This will reduce gradually after 3 months of pregnancy. Eating lots of fruits and liquids continuously throughout the day will help you in reducing and getting more energy throughout the day.